Welcome back to the Ed Show tonight. President Obama going to be playing a pickup game at the White House tonight. Arnie Duncan, Education Secretary. Tim Geithner? He didn't have any game. What's he playing for? And a bunch of blue dogs, they're going to be there. And I hope the president gives them a locker room talk. In all seriousness, the president has been on the sidelines, I think, way too long in this health care debate. Once the Finance Committee votes, he needs to just jump in the game and lay it out what he wants. This is a critical moment for the prez. A new poll yesterday showed a major uptick in the president's approval rating for support on health care reform. Pollsters say the public liked it when the president got involved. He spoke to Congress. He went on the road. He needs to keep the pressure on. A Quinnipiac poll just out today showed confusion still reigns when it comes to health care. 47% say they oppose the president's plan, but 61% say they support a public option. I also think Democrats need to start calling the Republicans obstructionists because I don't think the American people quite get it. Only 27% of them think the GOP is acting in good faith. Okay, they get that. But 57% of them say that they want a bipartisan bill. I have no idea what the heck that's all about. The Democrats can't focus on the Republicans to work with them, can't count on it at all. We need to move forward, and we will right now with Joan Walsh, editor-in-chief of Salon.com. Joan, good to have you on tonight. Thank you. The latest news out of Washington is that they're working on a state opt-in, opt-out deal. What's your quick take on that? What do you think?
You know, I'm going to be agnostic on that until I hear the details. I just want to go back to that poll contradiction you pointed to, Ed, because I think that is Americans being against gridlock, and they think that bipartisanism is the way to get around gridlock. They don't yet understand, because Obama, frankly, hasn't told them that the problem is there are no Republicans to compromise with. That's why we have gridlock. So in terms of the opt-in, opt-out, opt-in would be a disaster. Opt-out, I would like to hear the details. The only good point about opt-out is something that Paul Krugman raised on his blog today. He said it might be fun to see these red state Democrats or Republicans, whoever they are, telling their constituents, we're going to opt out of this cheaper plan. You're going to pay more because I'm on the payroll of the insurance industry. That might be interesting. So let's see what they really flesh out, Ed, before we get all over it. It could possibly work. It
would appear to me that it would pit states against states, because the conservative states, and they are out there, would say, hey, we don't want to be like them across the river because, you know, they gotta pay the taxes, their local taxes are going up. I mean, you all of a sudden have a target to blame, and it would be health care reform. So it divides people, and I think it's a dangerous move, and I think it's a sellout by the Democrats. What do you think?
I think it's probably somewhat of a sellout. Again, I'm passionately for a public option. I want a strong public option. This is a real compromise. Let's be clear. The only thing I would say is I think it's not just that subsidized people would get the public option. You or I, if we were unemployed or if our employer did not give health insurance, we could pay into it also. So you've got people who have skin in the game who are going to be handed over to the insurance companies to pay this now mandatory health insurance premium. I think those people will get smart if their state decides to opt out. It's not just like a welfare program, and I don't mean to disparage welfare programs, but you know, working people who are now forced to pay for health insurance would have to pay for it. They might say, why are you Californians have this great public option? Why are we in, say, Montana having to go without it?
All right, what's the play for the Democrats on the pushback on Medicare? Now, this is a sound cut from Harry Reid on Medicare and in the Senate finance bill. Here it is.
Ever since Senate Republicans opposed the creation of Medicare, they spent the past 40 years on the wrong side of history when it comes to helping seniors. In the past 10 years, Republicans have voted against protecting and strengthening Medicare 59 times. The American people can be excused for not buying Republicans' 11th hour claim that they're the true guardians of seniors' health care.
Now, today, the Republicans were quick to point out that in the Senate finance bill, there's a $500 billion cut to seniors. Who's going to win this war, Joan? How's this play out?
I think this is it's tough to explain in the abstract, Ed, and taken out of context. The Republicans have been using it, but I really think that Harry Reid's logic, said with a lot of passion and said often, can carry the day. They've always opposed Medicare. It's ridiculous to see them as the defenders of Medicare. And the cut is actually a complicated kind of restructuring. They will not cut seniors' care, and they will not cut Medicare. That's not what they're doing. So I think if the Democrats get tough, take on these lies, basically, they can win. If they are namby-pamby and try to compromise, they're going to get rolled.
All right. Joan Walsh, Salon.com. Thanks so much.